Hi, I'm Dennis Nix. I was president of the Medical Society in 1993. Probably the most significant thing that happened for those that followed me was that my tenure was the last time we had a part-time employee. Since then, we've had a full-time employee, and it's probably made the life of all future presidents and those in the past a lot easier. We did have a bus trip to Washington, D.C. when the talk of healthcare and healthcare plans was hot. We went up there, walked around, and got the runaround. We met our congressman, but I don't think anything happened from it. We changed the holiday party to a Valentine's Day party as everything was getting so congested around holiday time. It's felt that a little respite so people could have more fun later in the year was appropriate. We also voted to have physician's assistants become full-time members of the Medical Society, and that has carried on since then, and we have quite a few physician's assistants that enjoy being Medical Society members. At least I hope they enjoy being Medical Society members. I came here in 1982, and one of the things where it's not directly related to the Medical Society was related to our hospital. And those of you who are younger and have come in to see a giant medical center, at our time it was a big hospital but not a big medical center, and at that time smoking was still allowed in the hospital and on the grounds. In fact, in the surgeon's lounge, which was very interesting, was a old shower next to the operating room that had several overstuffed chairs, and you would meet there in the morning, sort of the getting the gossip of the day, and there are several physicians who smoke their way through it. So that has changed a lot. A lot of the older great American physicians are no longer with us, so hopefully you younger guys will carry on the tradition.
I'm Don Getz, and I was president of the Medical Society in 1982. Seems like quite a long time ago. It's my undeserved longevity here. But anyhow, back in those days, the Medical Society, I think, was much more politically active than it is now. We were in the process of developing our own health maintenance organization, Physicians Health Plan, which eventually became United Healthcare. And then we were also had a physician representative organization called SERPO, Southeastern Regional Physicians, which was sort of intended to be the political arm of the Medical Society. And the Medical Society is very cooperative and helpful in supporting all of those endeavors. And HMOs were coming to town, and that was a big controversy, and there was a lot of speculation and things went on about that. And so that was the basis of my year as president, approaching things like that and working on intelligent ways of responding to that. As an aside, I had one of my fellow Medical Society members who was my arch enemy, and his name was Clayton Calloway. He's still around, and he wasn't really my enemy, but we used to go back and forth together. And Clayton is a nationally known parliamentarian, and so as long as the vote was going in his way, or something that was presented that he liked, he would remain silent. But he was in the habit of jumping in there with his parliamentarian stuff to block issues. And so one time he did, and I said, Clayton, we're not going to let you in there to do the parliamentary two-step and block this issue, so I'm not going to recognize you. And we went on and passed it. I don't know what the issue was, but ever since then, Clayton has given me a hard time about the parliamentary two-step. And he's a great guy, and I enjoyed his company and and the interaction with many of the colleagues that I had as both president and a longtime member of the Medical Society. We had some great times, and there were some very, very great doctors involved, and it was really exciting in that time to see the rapid growth of the medical community. We had a very good medical facility at New Hanover Regional Hospital, and so it attracted a great number of very highly trained and fine doctors. Of course, the ocean was a big help as far as I'm concerned. I like to fish. I know Dennis Nix preceded me, and Dennis was a great guy. He was not afraid to tell anybody what he thought, and so people's opinion of Dennis varied between a loose cannon and a savior, and he and I think, worked together on a lot of things. We got a lot of things done, and we needed somebody like him to be a forceful president, and I think we had a lot of forceful presidents in our society. So I think that I'm glad to see the society doing well. I never realized it was 150 years old. I mean, that's old for a group of that type, and I think the historical aspects of it are very interesting. So I'm glad to see the society's celebrating the 150th birthday, and I'm glad to be a part of it, both the birthday and the society as president in 1982.
Hello, I'm Dr. James McCabe, past president of the New Hanover-Pender Medical Society in 2014. I've been a part of this organization since 1993 when I came as a young nephrologist in this community. I guess talking about the Medical Society, it's been a great honor to be a part of, but at the same time, I ask the question, who are we? Who is this Medical Society in this community? And I think about probably about 575 physicians and mid-extenders that work as part of this membership to make this community a healthier place for our patients. I think about 3 core values, I would say, of the Medical Society. And back in 1994, when I first had my first year here, I was asked to be a part of the Medical Society. I wasn't so much asked to come to the Medical Society meeting. I was told that I would come to the Medical Society meeting, that this was the place where you met your friends and future colleagues that you worked with. I think there are 3 core values that I think about. One is integrity, a part of this Medical Society. I think of friendships that I've made, and I also think of service that we provide to the community. And thinking about those 3 core values, first is an integrity. If you come to any meeting, walking in and the people that you meet, you realize that we have some of the, I would say, from a talent, gift, innovative population of physicians, we have the best. I thought training in some of the best academic centers, I was at the best. But in fact, we here at New Hanover-Pender Medical Society and the group of people that are part of this are the best physicians that I consider in the world. They've trained at the best hospitals, and then they come to this community and offer their service. Every meeting you go to, I'm still 23 years later, still going to meetings and meeting physicians who are new to our community, bringing new talents, new gifts, and really innovations into healthcare. And I think that only makes our surroundings better. We have some of the best technology these young physicians are bringing. I actually thought I was the young one in this medical society, but in fact, all these new and younger physicians that have brought new innovations and new talent to our community have just made our health for our patients better. So in fact, the integrity is very easy. When you come into this membership, you see some amazing physicians. The second thing is friendship, and that's what started back in 1994, 1993. My first year between that time was when I was told that I was going to the Medical Society meeting, and that's where I would meet physicians that really laid the foundation for where my patients would be referred and also where I would get referrals. But also just building a friendship of people that you know you could trust and that would take care of your family and you if ever needed. And so you build a strong friendship of people. And so this medical society provides an avenue for us to become not only just working community of physicians, but also friends, helping friends. So when it comes down to it, friendship is a big part of this. And then part of friendship is having fun, and we have a great time with these meetings. The third part is service, and several of those events that we've had through these years that I've been a part of this organization have been amazing. Not only have we given away pre-medical scholarships to future physicians, but we've also provided some hope for young college students to not only be mentored by different physicians, but also give them some inspiration that they may become physicians and ultimately come back to this community and ultimately provide better care for our patients with their new innovative things. So I think the service that we provide for the students in the community, for the college, has been amazing. Along with service comes several opportunities for this organization. We've been able to provide each year a donation to a very worthy cause, to the Domestic Violence Center, to the police, in order to help at-risk teenagers stay out of trouble, to provide avenues for a lot of great working communities for free health care in this area, to some of the clinics where people do not have insurance. So we've been able to help with those service organizations in a direct way every year. We've been providing free healthcare screenings for students that can't afford to go to see a physician for an athletic physical. So those are some of the things. During my tenure as president in 2014, probably one of my greatest accomplishments was helping a fellow physician. We had a physician who had a stroke with 5 children at home, and when you see a colleague quote unquote go down or go out of work because of a major health event, this was a very young professional, and seeing them still having to take care of five children really pulled this community together. So not only did we as an organization and as a community come together, we helped them directly with gifts and help that would provide not only future physical therapy, but rehab, and ultimately help for their children to be able to be in a community that they know they were cared for. So that's one of the biggest things that I think was a great accomplishment. So finding something, I guess each year, and I mentioned that to the presidents that have come after me, is that find something that you have a passion about and do something that will help this community. So I think, the 3 core values every day are brought front and center at each of our meetings. There truly is an integrity of physicians. There is a friendship that goes beyond words, and then ultimately a service that we provide to our community. So it's a very humbling and rewarding part to be, a rewarding part to play in this organization. I would encourage membership and thinking about things for our future. I think about the past, present, and future. In the future, with our physicians being pulled in 20 different directions between spending more time on electronic records, Epic, having hashtag everything, and being able to be in this digital age, I still think face-to-face interactions, being able to talk to your colleagues, to build friendships and then work on service projects that are not staring at a computer, I think ultimately will provide the best care for our patients to get the best health care they possibly can. So I'm proud to be a part of this organization. It is the best thing that I've had in my practice to come forth and to be a part of. And not only has it been rewarding, it has been just a lot of fun. And ultimately, at the end of the day, we all have to say, did we do our job, and how well did we do our job, and was it worth what we did? And I think it was. And being a part of this organization was the best that we could possibly, anybody could possibly be a part of.
Hi, I'm John Sanders. I was the president of the New Hanover-Pender County Medical Society in 2013. It's my pleasure to be part of the video celebrating the 150th anniversary of the New Hanover-Pender County Medical Society. And I'd like to thank Bonnie Brown for organizing this and for being the glue that held the society together for at least the past decade or two. And so thank you, Bonnie, and thanks to my colleagues in the society. I'm an infectious disease specialist, and I've practiced medicine 30 years and 20 years in infectious disease and clinical practice and teaching. I have 2 children. One is a biomedical engineer and one is in environmental science. I'm a North Carolina native, and I trained at UNC and Mayo and Hopkins and wanted to come back to North Carolina to help with medical care in my home state, and it's worked out well. And part of that ended up being a participant in the New Hanover-Pender County Medical Society, which has been a very enjoyable experience. We had a good year in the society in 2013. It's summarized in the newsletter of that year, so I'm not going to tell you everything that happened that year, but I'll point out a couple of highlights. We improved our website for the membership's information. We increased our membership that year. We had a very solid executive committee that year. We provided scholarships for a pre-medical student at UNC Wilmington. We provided funding for the domestic violence shelter here in Wilmington. We provided free athletic physicals, as has been done yearly for many years. And we continued monthly meetings that delved in social and legislative challenges facing medicine, and inspirational honors for prior members with 50-year and lifetime awards. In addition, we had a somewhat unusual endeavor that year, and that concerned members of the Medical Society for about 2 years had signed a petition and had ongoing concern about an environmental issue, which was the construction of a plant using coal power to manufacture cement. So after 2 years and 2.5 months of preparation that was spearheaded primarily by Robert Parr, a physician and environmental scientist, a group of us proposed a resolution to present to the governor to try to block the environmental impact of that. And that group included several individuals in the society at that time, the president, Philip Brown, and people that were active in that issue, including Bob Parr, myself, Fred Opper, Bill Buchanan, and David Hill and Ed Herger, pediatricians. And Lydia Wright was also involved, obstetrics. And that was eventually successfully presented to the governor, and we had a couple of meetings with the governor's staff. The air permit was granted, but over time, with additional efforts by the North Carolina Coastal Federation and the Southern Environmental Law Center, the plant plans to build ceased. And I think the effort of the Medical Society contributed to that. And that's a good example of physicians also being involved in preventive and public health because the effects of cold combustion include heavy metals in our waterways and particulate matter that is a well-established risk factor for coronary artery disease, heart attacks, and respiratory disease. I also wanted to state what I felt were the main functions of the Medical Society, and I'm going to read from the newsletter of 2013 to be sure I get these right. The most important functions are to present a unified commitment to patient care and public health to the general public, to educate members on constantly changing scientific, cultural, regulatory, and economic issues, and assist in leadership development, to address self-care of healthcare professionals not adequately provided in the office, hospital, or home, and to support charitable causes relevant to the health of the public. An important principle in this medical society that has been particularly emphasized by Bonnie Brown, our executive director, is that all members are equally recognized for their efforts and achievements. And there have been several very inspirational meetings that honored physicians that have gone before us and blazed a trail to make it easier for the rest of us. I can't help but wonder what the concerns of physicians in 1867 were. Some of these are written down, of course, but we didn't have the technology for video and digital methods that will store the information over time. I think they probably, and from what I've read, wondered and wished for more tools and more scientific knowledge. After all, that was 30 years before Osler wrote his first textbook, and in that textbook, around the turn of the century, about 60% of it was dealing with infectious diseases. When I trained as a medical student in the 1980s, only about 25% of the textbook of internal medicine was devoted to infectious diseases. But it was not until about 60 years after this medical society was founded that antibiotics were developed in the 30s and 40s. I can't help but wonder what physicians 150 years from now will think, or and what their concerns will be, and what they will think when they see us, perhaps if somebody watches these videos in the future. Perhaps they'll have more targeted therapies, like a recently conceived monoclonal antibody attached to an antibiotic that's delivered directly intracellularly for intracellular killing, and it doesn't kill normal bacteria in the gut, causing C. difficile colitis. They'll probably have more specific directed targeted therapy for cancer, where only cancer cells are killed and normal cells are not, preventing neutropenia and other side effects of cancer therapy. We already have some of those tools available. I can't imagine how much better it will be then. We will probably have some immune and immunologic and genetic therapies that can even prevent these things, so we won't necessarily need antibiotics or chemotherapy. We will still probably have diseases like plague. That would be 150 years from now, 300 years from 1867 when this society was founded, which is 300 years after the bubonic plague in the Middle Ages. So in another 150 years, that would be 300 years after this society was started, there will probably be plague and tuberculosis and influenza and cancer and coronary artery disease and diabetes. They will have new and emerging diseases related to global travel, deforestation, and global warming. Whatever happens, I would offer this advice for the future. And despite efforts at cost containment, efficiency, and access to medicine, all very important concepts, I would advise future physicians and medical societies to focus on keeping the physician-patient relationship sacred, the Hippocratic Oath, that special bond of empathy and confidentiality that is centuries old, and to continue to demand that the best trained persons delivering direct care or leading the team that delivers that care be the head of that team or the person delivering that care, and to fight to continue humanistic and scientific education in the face of anti-science, and to continue evidence-based standards of care. And in concluding, I would say, many of us have heard this, and it's been said by other members of this society. Patients want the following: doctor, help me; doctor, don't hurt me; be kind to me. And to that I would add that competence is the greatest kindness, and we can be very empathetic and very kind, but if we're not competent, we are not providing the utmost kindness to our patients. Thank you, and good luck to the physicians and the medical society over the next 150 years.